Welcome, everyone. I'm Leslie Walker Harding. I'm chair of the Department of Pediatrics at the University of Washington School of Medicine, and I was a committee member on the National Academy's report, Social Media and Adolescent Health. Today, I'm your moderator. We are discussing a really, I think, hot topic, the digital lives of children. How do they spend their time on devices? What impacts on screen time? How does that impact their health? How does screen time intersect with playtime? And what should worry parents and what should not? Joining me today are some wonderful experts and people I can't wait to talk to. One is Leah Austin. She's here. She's president and CEO of the National Black Child Development Institute. We have David Bickham, research director at the Digital Wellness Lab at Boston Children's Hospital. Scott Eberle, former editor of the American Journal of Play and former vice president for interpretation and play studies, the Strong National Museum of Play. And he currently writes for the feature Play in Mind for Psychology Today. And we also have Jason Nagata, associate professor of pediatrics at the University of California, San Francisco, and senior editor of the Journal of Eating Disorders. So it's a great lineup. So let's get started. Today's children, and often their parents, are complete digital natives. Screens, whether they be on smartphones, tablets, smartwatches, TVs, or other devices, are everywhere. And David, let's start with you. At this point, should we be talking about time spent on devices or the content that's consumed on them?
Well, thank you, Leslie. This is really a key question. I think the content is definitely what we need to be considering when we examine the potential impact of screen use. And so for very young children, this often means the educational content of videos or television shows. And we know that good educational TV can lead to positive long-term outcomes. And for older kids, this means looking at things like the characteristics or the aspects of their online life and their social interactions. So, for example, we'd expect something very different outcome for someone who's interacting with friends and planning friends from school and planning activities and doing that online than from someone who's exposed to cyberbullying or other toxic online environments. We'd expect the outcomes to be very different. And even when something seems very common sense, like screen use displacing play or replacing play, that's actually much more complicated than we might think. So if you think about something like free outdoor play, just shutting off a screen doesn't magically make that space available to them, or doesn't make it light outside or safe to go outside. And there are actually a lot of structural components involved, and there are even cultural components. In our study, we found that in the US, the more time that children spent on screens, the less time they played. But in Mexico, the more time they spent on screens, the more times they played. And so things like the spaces provided to them, the activities encouraged, the cultural perspective of these behaviors, and what parents really think about the value of them, doesn't just impact the amount of time that children spend doing that, but also the relationship between things like media use and play.
Wow, it sounds so complicated in some ways, because each child, all the things you brought up, each child could experience all of those things at different times, depending on what media they're on, and where they are geographically or culturally. So that's really interesting. I'm curious, Scott, what can we talk about play, and David mentioned play. What are the elements of play? What does that mean when we say that?
Leslie, that's a good question. Play is hard to define. It's a noun, it's an intransitive verb, it's an adjective, plays all over the place. I found it's helpful to narrow play into 6 elements. Begin with anticipation, what's next? On your mark, get set, go. And then surprise, peekaboo. And then pleasure. Play rewards us with good feelings. Then understanding. Understanding has mental and physical mastery and mutual enjoyment and trust building. And play also builds strength, mentally and physically. Go for it, just do it. And then for the luckiest, poise, fulfillment, balance. You can see this emotion on the faces of the Olympic gymnast when she nails a landing. And poise is pleasure. Those are fractal elements, I guess you'd say, of play. And when one of these elements is missing, the kind of thing David just talked about, let's say internet scams or criminal dog fighting, then a play will fail to yield its dividends.
That's really interesting. And so what I'm hearing you say, and I would love to hear more, is that there could be some beneficial aspects to play even in screen time. I'm interested in, how you would think. What do you think about that?
Well, Leslie, yeah, you put your finger on a key point there. Screen time can be free play, and I don't have to tell the rest of you that free play is key to full childhood development. So it's easy to note how social media increases opportunities for building connections, for example. And it's also in light that kids are increasingly managed and assigned. The time spent on social media, it's good to remember, is voluntary. And it's a respite from pre-planned activities that are designed by adults. In this respect, play is freedom. And kids love that, like the rest of us. You hear a lot of complaint about kids on social media. It's reasonable, but there's a caution to keep in mind. Let the historian in me talk for just a moment. The complaints about social media can smell like moral panic, and we've seen plenty of moral panics in the past about kids' entertainment. Novels were once dangerous. Hard to believe. Comic books, of course, rock music, dance fads, hairstyles, fashion trends, heaven forbid. But actually, as I think about it, heaven has forbidden some of these things in the past, because we're a nation who were founded by Puritans who were happy to describe themselves as fanatics. And the founders' effect can linger. And we also should remember that unfounded fear can lead to repressive policy.
Well, Leah, I want to go a little further with this. Your organization focuses on early childhood development from birth to 8 years. Can you talk about the impacts of screen time and play on the developing mind and younger children? I also had a question too, as Scott was talking about, does the screen time, does social media tell kids how to play? I'm curious what you think about that in terms of development and at what point they get into, screen time.
Yeah, so already such an interesting conversation is brewing. I'm finding myself nodding and thinking and being challenged even in my own thoughts. What I will say about young children, and when we think about sort of the youngest digital natives, is that, excessiveness. So when we think about how much time they are actually spending on social media or in front of screens, we still do have to really focus there, right? We still, that is part of the conversation we still have to have. It's not so much a conversation, I think, of should they be on screens anymore. I think we are probably all aware that train has long left the track, the station. But we do still need to think about and understand how much time they are spending. And so just a few quick reminders. The American Academy of Pediatrics recommends no screen time for children up to 24 months, so babies. No more than 0 to 2 hours a day, or excuse me, for children up to 24 months, no more than 0 to 2 hours per day. Children 2 to 5, 1 hour, and children 6 to 8, 2 hours. And so I think the question we then have to ask ourselves is, in our reality, and I am a mother, so I will put myself out there. In our reality, how much time are young children, and again, your question to me is about birth to 8, how much time are young children really spending on screens? And then I think the second point I want to draw on is in front of screens. And I think, yes, there are ways in which watching something can be a part of your play routine. It can be a part of free play. I think there is a part of it that may be a bit self-directed. I think we'll have a conversation as we go further about algorithms and biases, which then would challenge how much self-direction is actually happening and how much control is happening, maybe not so much by a parent, but by other factors who are taking that algorithm that the child doesn't even really know that they're creating and really directing and managing what they're doing. So I want to just kind of go to the watching and the being on social media piece for a second, because as we connect that to brain development, I think what we have to think heavily, and what we talk a lot about, is how much of it is in fact passive watching. How much of it, and I know, again, we probably have all seen this before. I will fully admit my own guilt to, my son is now 10, but I will admit full guilt to maybe one day putting just, a device in his hand when he was younger. People do that, right? And that's what we would call like passive social media time. And for very young children, what we know is that is not as helpful to their brain development, because it's passive, because they are potentially just watching, they're just hearing a story, they're watching a show. This period of time where their brains are developing, it's the most rapid time for brain development in a human's lifespan. And this is a time where if you think about the synapses, they want to just go like ping, 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 ping. And you're passively watching something. The synapses are doing more like a ping, right? It's like a slower ping. It's not the rapid pinging that we need them to be doing during that time frame. And so that's why if there's a significant or an excessive amount of time on social media, that's where we get really worried about what's happening to their brain development. Another piece is around language development. So we know that in particular for infants and toddlers, so that would be like your birth to age 3, age 4, language development, literally hearing the language of your parents, of your family members, like live and upfront, is really critical to developing not just your vocabulary, but your accent, to understanding sort of the cultural undertones of your language. And so if the language that you're hearing is primarily coming sort of from the distance, because it's coming from social media, there are concerns about how that is detrimental to healthy language development of young children. And then I guess the last thing I would just say, back to sort of this point about not having it be passive, is also having parents or adults sitting with their children. I think that is where you get into some of the beneficial nature of social media for play, because you're engaged with the child, you're asking questions, you're kind of learning and being with each other in this moment. And that's a way that we do see that you not only can be kind of monitoring and understanding what they're watching, but also participating in the learning and helping them, facilitating the learning, which is a large part of a parent, and I say parent very loosely to mean many adults that are in a child's life.
Yeah, that's wonderful. I want to make sure we do not forget to ask you about some really interesting work you did with Google. I heard that you worked specifically with them to promote joy in a fun and safe environment for young Black children. I'd love to hear a little bit about that.
Sure.
What that was.
I'm happy to talk about that work. I think it connects to your question around play as well. So at NBCDI, we've developed a framework that includes 8 essential outcomes that we believe, when they're met, ensure that all children, quite frankly, but we do have a focus on Black children, that they will have a happy, healthy, and joyful childhood. And it covers everything from clean air and clean water to having affirming and expanding learning environments, to having books and toys that reflect who they are and can be. And then, of course, having a safe and appropriate internet. And so, as you mentioned earlier, we worked with Google. We partnered with Google to curate a list of teacher-approved apps that are featured in the Google Play App Store. And these apps are a way for children to learn and express themselves. They are really affirming in terms of who they are, who they can be, which is something that's really important to us, that they're expansive. And as we discussed in terms of being with children and not having this sort of passive social media time, each of the apps really focuses on family engagement and encourages parents or other adults to really play and learn along with their children. And then, of course, each app is connected to one of our 8 essential outcomes.
That's really exciting. I'm going to have to make sure my children and grandchildren hear about this. So I'll have to look out right after this on the Google Play Store. Thanks.
Absolutely.
Leslie, could I interject here a second?
Sure.
When my daughters were young, we curtailed TV watching. We allowed them to watch musicals, and we sang along with them. So to hear a 4-year-old sing 76 trombones, we'd sing along. Or what was particularly hilarious, Leah, I have to tell you, one of their favorites was Porgy and Bess, and to hear a 4-year-old little blonde girl sing "Bess, You Is My Woman Now" was hilarious, I'll tell you. But we're singing together.
Yeah, very active.
Can I say something real quick? Leah, I just wanted to say congratulations on that work with Google. That seems so incredibly important. And I think that's the kind of information that parents are so hungry for, because they see the value of this and they're like, we just need to know what to do. Give us something to use that's positive. And I think it really highlights a point I was making about, like, if we choose good content and good platforms, it can be and have this positive impact. And to me, that resonates more than a time-based recommendation, because I think that's where you end up with the parental guilt, right? It's just like, oh, maybe they did use more than this, and like that just makes us all feel lousy. So like I think like this strategy of arming them with these positive tools is just, that's the direction I think we all need to be headed in.
Yeah, that's great. And now, as an adolescent medicine doctor, I want us to also think about, this. We've talked a lot about the impacts on younger children. I'd love to have a quick shift here and, understand and talk to Jason a minute about older kids and teens and, social media use more specifically. Jason, I know you've done a lot of work in some very specific areas here. What are you seeing?
Yeah, thanks so much. And I agree with what has been mentioned earlier. And I do think that we have been seeing, a large increase in screen use, especially social media use, over the last few years. We've been following 12,000 adolescents since 2016. And we did actually find that screen use doubled to 8 hours a day at the height of the pandemic, which has since got decreased slightly, but is still well above pre-pandemic levels. And I do think that one thing that's important to note is that while I do think that there are certainly limitations to measuring screen time as the main metric, I do think that when you're spending 8 or more hours on front of screens, one potential impact is just the displacement of other activities. Largely, sleep is a really important one. We already know that 1/3 of teenagers don't get enough sleep. And so when you're thinking about teens being on screens for many, many hours, especially right around bedtime, that can even decrease their sleep further. And we already know sleep is so important for development and growth and academic performance. Another interesting area that we've been researching is links between screens and nutrition and diet. And we have found in this study, the Adolescent Brain Cognitive Development Study, that over time, more screen use in general has been linked with more weight gain and eating more unhealthy foods. Some thoughts about that are that when you're eating, especially in front of screens, like if you're eating during family meals, you may be distracted in front of screens. You may be more likely to overeat. Even if you're not hungry, you just might ignore those hunger cues because you're sort of just focused on whatever is going on in front of you in the screen. And so we actually did find that like binge watching Netflix or binge watching programs is actually linked with binge eating and overeating. And some studies actually that have started, that have gone on for decades now, have actually linked, more screen use in adolescence and young adulthood to future like heart disease, including heart attacks and strokes much later in life. And so I do think that, the amounts of screen time that today's adolescents have is quite a bit higher than they were in previous decades. And so I do think it'll be interesting to see what really the long-term effects are, decades from now, especially with the relation to displacement of sleep and sedentary behavior. I will say that on the other hand, while in general screen use is linked with weight gain and overeating, there is also a subset for which screens and particularly social media use can actually be linked with eating disorders and restrictive eating. And that's my clinical specialty. I take care of adolescents, young adults who have to be hospitalized with eating disorders. And unfortunately, one potential reason why social media can be so key in this linkage is that, traditionally media has been a big influence on adolescents' body image, whether it's Hollywood movies, magazines, television. But with the recent advent of social media, I do think that one unique aspect is that for the most part, teenagers watching or consuming television, movies are living in a read-only environment. Like they wouldn't expect to ever be featured on a Hollywood production. But with social media, anyone can produce content. And so there's this new pressure for teenagers to actually put their own bodies on display in order to get likes and followings and interactions with friends. And so I do think that this added pressure, the constant comparisons, and the algorithms can really lead to more susceptibility and vulnerability to body image issues, even in ways that are unique to the traditional media forms. And so I do think that that's a really interesting aspect of social media that we do need to be aware of.
Yeah, no,
and then the final thing that I was just going to mention is that there's a lot of discussion, again, beyond time, what else like really could be red flags for parents. And I do think that there's been a lot of discussion lately about what constitutes problematic screen use or problematic social media use, even with elements kind of related to addiction, like, withdrawal, tolerance, relapse, leading to problems at school, problems at home. And so I do think that there's a lot of research being done right now about like what really constitutes problematic use and how can we help people, the subset of people for which it really has led to functional problems or school problems.
Yeah, no, thank you, Jason. I think you brought up some really key issues that, and again, another time where the brain is really developing, hardwiring how to be a great adult, how these can impact that. When I was on the National Academies Committee and we began to learn, I learned some really amazing things that I had no idea were going on behind the scenes, like the algorithms and how, platform features, which are called affordances, how these platforms are put together so that it can accentuate something like if, I want to lose weight, and then you put that in there, and then all of a sudden you start getting this loop, of amplification, which could be great, could be harmful. It depends on what the algorithm prioritizes to show you first. And so, with kids, that could be, I think that's a quite profound issue that we have to think about, and how it's used well and how it might actually be used and cause harm. And I think, Leah, you had some information on how is this data even collected? What do we know? What do the social media firms and different companies know? And do we all know the same thing?
Yeah, I mean, what I'll say is this is an issue that our organization is really learning more about and really taking up as we are just seeing that it's becoming clearer to us, both as an organization and I think as people, the the depth of the issue. And I say it that way because it's not as if it just started like today. It's been happening. And so a couple of things that we're thinking about and concerned about are, one, what you just said, Leslie, which is around what is the digital reality that is being created with these algorithms. And I think on one hand, we can think about it in like there's and I know we've all had this experience that feels a little, sometimes it could feel silly. It even can feel convenient, like, oh, well, my favorite snack shows up every time I look at my phone, or I mentioned this shoe brand and now it's all over everything. It's on my TV, it's on my computer, right? But we're really thinking about and learning from some true experts in the field around how it is actually quickly moving from convenience and silly and humorous, like in the examples that I just gave, to really quite frankly dark and detrimental. And so a couple of examples would be that we're seeing that many schools, so it's showing up in a lot of different systems, and I'll just use like the school system as one example since we're talking about young people, that school systems are buying these generative AI, these predictive analytic tools that are being sold to them with the sort of sales pitch that sounds like, you know, it's going to really take this administrative burden off of you, and who doesn't want that, right? That sounds great. It sounds like we can really help you understand the future of your students. You'll know where these second graders will be just by plugging in this data. Again, if you're the superintendent or the chief academic officer for a school district that serves 200,000 students, that may sound really helpful and convenient. The issues are that we are predicting something that is transformational, like high school graduation, based on historical data that is data from like a point in time, right? So we might look at Leah on Thursday, September 5th, was just in a horrible mood. And for whatever reason, she, you know, smacked David. Sorry, David, your name was just the name right in front of me. I would never do that. And so then that goes into my record, and generative AI now predicts that Leah is just a violent person. And you know what? Also, her grades aren't that great. So she's probably not going to graduate from high school. Right. And so it may sound drastic, but it's actually not. It's like in reality, what's happening. And it's happening in a detrimental way, primarily to Black and Brown students, where their futures are being predicted by AI, by these data tools that they're incomplete. They don't have the full story. They don't have the context. And so in many ways, they've become kind of modern day tracking tools. And so that's something that, again, we're really concerned about what that means, what's happening for students now, and what it just could mean moving forward. So I'll stop there, but that's really the issue that we're really taking up, is how this predictive tool on one hand can sound really helpful and convenient and transformative. On the other hand, can be really, really dangerous and detrimental.
I've had a lot of pause about that, you know, learning more on the committee, and just, you know, especially knowing during adolescent time, there are, you know, people can have the ability to have dramatic change, you know, so if you've already pigeonholed them into one direction and you're not trying to pull them out because of an algorithm, that could be really devastating for families. I have now, you know, we want to make sure we have some balance here and really thinking about some of the benefits as well, because there are some benefits that could be had. And, you know, in particular, you know, with Scott and Jason, I'd love you to give some input on this. You know, how can social media be helpful, you know, with in terms of finding your people, or, you know, validating who you are in a positive way? What would you say to that? You know, what are some of the benefits or micro communities you think would be could be helpful for our children and adolescents?
Yeah,
Jason,
I think it's really important to note that social media and screen use isn't inherently good or bad, and there definitely are benefits. And, you know, social media was really originally created to foster socialization and connection. And this is, I think, particularly helpful for minority communities. You could imagine, for instance, an LGBTQ youth who may be socially isolated in their school. Maybe they're the only youth who's out or one of very few. And so in their physical environment, they may have limited access to people who they can share their lived experience with. But if you go online, they may be able to connect with so many youth across the country, across the world, share experiences, get connections, and really receive a lot of support. So I do think that particularly for minority adolescents, not just sexual and gender minorities, but racial ethnic minorities. One other kind of interesting thing that we've noticed is that also for even some of the patients that we care of who have relatively rare diseases, they may be able to connect with other people around the world who also have those similar lived experiences. So I do think that one of the strengths of the online community is really being able to connect with people all over the world who may have a shared experience.
That's very powerful, Scott.
It's an important question. There's a simple answer. If you can find like-minded kids online, that's a good thing.
Yep. Let's see. I think we're running out of time. This is such a exciting and topic that has so many different aspects to it. But why don't we move, because I'm sure many people that are listening are parents. Why don't we move to some advice for parents? David, you've researched parental influence on the digital lives of their children. The people who are raising children now are, like I mentioned earlier, are really fully within the digital footprint. They grew up with social media and digital. They have a level of digital competence. What advice do you have to keep their kids happy and healthy online?
I mean, first off, we should all strive to be very intentional users of our technology. And I think if parents can help children have that kind of relationship with their tech, set up their device so that it works with them and they're in control of it rather than it constantly vying for their attention, that this is a good thing to always have as a goal. But in fact, we know quite a bit about what makes good digital parenting. So having young people who have families who are involved with their online lives the way they were involved with their offline lives. And this would be through rules or expectations about behavior with tech. Those kids do better both online and offline. And for young kids, when they're young, this is the opportunity to set up the family norms and behaviors that can last a long time. So things like none of us use our devices during meals. That's just a time when it goes away. None of us sleep with our devices in our room. We charge them outside of the room. Like these things that, what happens in an online space is something we talk about. We talk about the video games that we play. We talk about the entertainment that we have. We talk about who we're engaging with online. Like setting that up is what is normal in your house, I think can preempt a lot of problems when kids get older. When they do get older and when you are sort of implementing rules, it's important to remember that adolescents will, they'll push against rules that they see as unfair or unreasonable. And you want to reduce, you want to have a family plan that reduces that kind of reactance to what you're putting out there. So they need to be engaged with the decisions about the technology use in the home. They need to be involved with those decisions. If you're making a rule, you need to explain to them why. Like, why are we doing this? And what is it that we expect to gain from it? And parents need to follow those rules too. Like if you say you can't use it at the table, but I'm going to, like that's immediately seen as unfair. And I think these are, fairly straightforward things that we can do that are expansions of how we already think of as pretty good parenting. I also think these policies, right now, all over the news, you see schools that are setting up phone policies for their schools. And these kind of policies, I think, need to be implemented by schools as well. Like, why are we suddenly just imposing these rules on kids when we could be engaging them in a dialogue about it, at least explaining to them why we're doing it with the goal of better educational setting and a more distraction-free zone that helps them to try to build their buy in with it and follow through on it. So I think if we think about it in that realm, think about the involvement with adolescents, then we can have expectations and guidelines that they'll buy into much more.
Yeah, I think with the schools, that's particularly interesting to me. I know on the study we looked at schools, and one of the things we thought about, how this happens in medicine too. People get together and they make all these recommendations. The teacher needs to do this, 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 and this, and then if you did half of them, it would be the end of the year already. It's so many recommendations. But one of the things we thought is how well are our teachers and our administrators prepared to even do this work, and how is it involved, enfolded into the curriculum and learning, like every other type of thing that skills we need to have that we want to learn in school.
I think we're often, we're providing in schools. A lot of times a child's first ownership of a device comes from the school. And so we're providing them with devices with, I think, without the sort of educational background necessary to really learn how to balance the distraction of the fun of that device with the, with the need to complete the academic work. I mean, we as adults struggle with that. So I think we need to start pretty young at trying to figure out how do we teach that balance and do it along with any time we provide them with the technology.
Thanks. So this is a wider question, because we're talking about screen time. We haven't defined what that is. Is there a screen that's better than another screen? Like you mentioned that the schools are now saying no phones. There are many schools that are enacting that. But is there a screen that is worse or better than another screen? I mean, what is your opinion on that? There's TV screens, there's computer screens, there's phone screens, there's gaming, there's all kinds of things going on here when we talk about screen time. And so what's all of your opinion on
Leslie,
one screen?
That's a very interesting question. Decades ago, Sesame Street tried to make it one of their goals that adults would watch along with children, play along and sing along and add and subtract and do all those other things in their curriculum. And I'm encouraged in this respect. I have a 5-year-old grandson, and we watch a program together that's called Number Blocks. And it actually represents, you may know it, David, it actually represents mathematical concepts physically. So I have to tell you that my 5-year-old now understands cube roots in a way that I don't think I ever did.
Okay.
I mean, I think, my knee-jerk reaction is no, what type of screen doesn't make that much difference? But I think there's one component of it, and that's mobility or the mobile aspect of it. There's a bunch of research done when we just had televisions that showed, if you there was a great experiment, right? They gave kids a tool to shut the TV off, had to type in a code. Kids that did this really improved in their weight gain. The weight gain was much normalized, but what didn't happen was they didn't change their physical activity. So what the mechanism was not they went out and played more. There was something else. At the time, it was mainly explained by advertising, which I think is something we didn't talk a lot about, but is important. And I do kind of believe this. I sort of outlined it before. There's really structural reasons why kids can't just suddenly go out and play if you shut a screen off. But if you have a mobile device on a playground and your kid is sitting on a bench on their phone, I'm starting to think, well, this is a kind of displacement that's happening in real time. That they're missing out on something that's right in front of them. And so I think that we need to better understand this what happens when we're carrying phones and these devices with us all the time, and we're interrupting physical activity, we're interrupting moments where we're just interacting with each other, or just sitting in silence with ourselves, or learning to cope with waiting in line, and all these things that we use mobile devices to distract ourselves from. We don't really understand what happens there. And that to me is a type, an aspect of the device itself that we should have a better understanding about.
Yeah, these new games that emphasize full range motion, engagement in play. I mean, I guess we'd all rather have kids climbing trees and on the jungle gym. But that's not really practical. But if they can these new technologies that find a sweet spot between watching and playing that involve physical activity, dancercise, active gaming. If you've ever played on a machine called Dance Dance Revolution,
Oh, mhm.
you know what I'm talking about here. You can have fun, you can move, and you can watch the screen at the same time.
Yeah, that's interesting. I think we're coming down to the 5-minute warning sign. So I would like to make sure, Jason, Leah, if you have, and then David and Scott, if you had one thing you needed to tell people before they get off this call, what's the most important information you would love to share?
Yeah, I guess I can start just to follow up with this discussion we've been having. I do think that, screens aren't inherently good or bad. And so it's really hard to have a one size fits all solution and to say like this type of screen is good or bad, because we know, you could access social media from your tablet, your phone, or, your computer. And so I think there's a lot of cross pollination. That being said, I do think that as physicians, as teachers, educators, people who can advise, I do think that the overall goal is to really optimize any of the parts of screen use that are beneficial. So if it really is improving socialization or learning, go for it. But if it's, making you feel worse about yourself, if you're having constant comparisons that make you feel worse, if it's ruining your sleep or making you less active, those are potentially reasons to try to limit your screen use or when we're doing that. So I do think that, just trying to optimize all the benefits while minimizing some of the health risks we know is a general guide for parents and adolescents.
Oh, thank you, Jason.
And I'll just say, I'm actually thinking about something David said around being as intentional about online as you are about your offline life. And I think that's just a really clear and beautiful way to say it, is like, there's no escaping either one. Our lives are both. And so how do we ensure that we intentionally create a healthy balance, a healthy, robust, and expansive experience? I wanted to say that in terms of one of the benefits is that it can be a really expansive opportunity for a child in Atlanta to learn about Tokyo just by typing it into their computer, and they have all this amazing, wonderful information down to literally being able to see the place itself without yet stepping foot there, right? So there are tremendous benefits, but I think, I think that's what I would leave the audience with, is like this intentionality of how you're designing your online life and your offline life is just really critical.
Wonderful. Thank you, Leah.
Yeah.
Power minute.
I think I would say, to parents to take a deep breath. I think it's always like, if I had a goal in what my work is, like reducing the guilt for parents in media is just any way we can do that. And I think to recognize just it's part of your kids' lives, apply your strategies and what you think about as important aspects of your kid's life. Apply that to their online world and be a part of it and enjoy the media with them, because there's a lot of fun things to do out there. And playing it with them makes it mean that they'll come to you when they run into problems more, because they see you as someone that isn't going to just take it away from them. And that level of engagement and fun, I think it's just gonna make your relationship with your kids that much better.
Thank you. Scott?
Well, you asked for one, but I'll give you three. Play is good. Playing while moving is better, and playing together is best.
That's amazing, very quick and very complete. When I'm listening to all of you, it really it underscores that we need to stay present, stay engaged, stay mindful of what we're doing with our young people, with ourselves, and within our families. I think this has been really helpful, and I hope that people are stimulated to look further and to think more about this, as it's such a huge part of our life. And we have come to the end of this event. It was really quite fun, and I've enjoyed talking with all of you, and I hope you all got something out of it who were listening. And thank you so much, everyone, for joining us today.
Thank you, Leslie.
Thank you.